Have you any idea about the various types of drug reservoirs in our body? Well, yes, binding of the drugs to plasma proteins is the best answer I am expecting from all of you. But you ought to know many more. Actually, you deserve to know many more, and all of them. So without any wait, let's get to know all. Welcome all to IS Pharmacology Difficult Podcast. I'm your host, Dr. Radhika Vijay, MBBS MD Pharmacology, and this is the audio hub to get the best simplified basic tips, strategies, methods, and lots of ideas to learn better, understand better, and make your concepts crystal clear. If you really find and if there's a question hovering in your minds, is pharmacology difficult? Lend me your ears for a while and let in the magic of knowledge. Here comes the Magni Manus Monday. Now just clear your mind of one of the facts that is very important. Actually, it's not any rule, not really a hard and fast rule or any sort of implication that if a drug binds to a particular site, a particular organ, tissue, or place, it has to perform a pharmacological action at that particular site, place, tissue. Is this thing clear in your brains? Binding is not equal to the pharmacological action. Yes, do write this equation, learn it, memorize it. It's very important. I hope you got it really nice. Now, some real good to know reservoir places of drugs in the body starts with the details about binding to the tissues and the tissue proteins of the drugs. This happens only and only when the tissues or the tissue proteins, they have much more affinity as compared to the plasma proteins for the drugs. The drugs, they can bind to the lipoprotein, they can bind to the nucleoprotein, and some worthy names in this particular context include binding of iodine in the thyroid tissue, chloroquine in tissues like liver, kidney, etc. And chloroquine, for your very kind and great information, it binds to the retinal nucleoproteins also. Now, another drug binding to the melanin pigment in the retina is not chloroquine, it is chlorpromazine. I hope you got this right. And the last mention in this particular context is about digoxin and emitin, which binds to the skeletal muscles, liver, heart, kidney, etc. Now, I want to tell you about highly lipid-soluble drugs. Yes, when I'm using the term lipid-soluble, then what picture comes in your mind about the reservoir? Definitely, it's the adipose tissue or the fat. And one of the examples of the highly lipid-soluble drugs is the thiopenton. It selectively chooses fat as its settlement area. What happens in normal states? In the normal states of the body, the blood flow to these adipose tissues, to the fat reservoirs is very, very slow. Yes, it is as sluggish as a seal. It doesn't move, no dynamic thing, nothing in motion. But whenever there are situations or conditions of fasting or starvation, then the motion sets into the adipose tissue or the fat reservoir. It comes into a dynamic state. And then slowly the fat or the adipose tissue, it wastes away, and the toxicity of the drug that is accumulated there, that may occur. Now that's a real dangerous thing, and you should be very cautious whenever you are taking or administering to anyone lipid-soluble drugs. Do keep the condition and the state of the body in mind. Got it? Now, traveling on the similar pathway are the bones, the teeth, the nails, all these connective tissues. They too form the settlement sites for compounds and drugs like lead, arsenic, fluorides, and tetracyclines. Griseofulvin is one of the drugs, in case you might know about it, which selectively chooses and binds to the deposits in the keratin precursor cells of skin and nails. Now, for your good, gracious, and real kind information, let me tell you that some storage body sites and paths like peritoneal sacs, endolymph, pericardial sacs, they also can serve as places to store the drugs. Now, let me list you some few of these wonderful places and the drugs associated. Methadone, imipramine, they find real good place to accumulate in the pleural cavity. Next, ampicillin easily collects in the joint fluid. Next, sugars like amino sugar, sucrose, they get real good collecting place in the cerebrospinal fluid. While aqueous humor of the eye, it houses prednisolone or chloramphenicol. Did you note down the whole places and their associated drugs that may use them as their dwelling sites? Now, all this was a real quick verbal documentary about the places I wanted you all to know, apart from the plasma proteins that store, house, or collect the drugs. And yes, do remember that drug may not always show action or effect at these sites or places, tissues, or organs. Everything depends, Yes, it depends on the body state, on the state of the health, on the state of the disease, on the amount of action, workload, stress, rest, etc. Now, these add-ons, these are the bright pieces of extra information that are poured to you today, just like pouring of the extra cappuccino in your cup of coffee when you are done with 1 cup of coffee already. Wow, these were some few of my stolen memories from my leisure spent times in the Grasswood Cafe. Hey, anyone visited that in the City of Lakes in India? It's okay. If you really want to have a glimpse of that, check on my audiogram for the day. I'll be posting a clip of that beautiful cafe's cozy interiors in the audiogram for the day. I hope you have a great, majestic Monday and really not a manic one. Hope it becomes well-mannered and managed by all means. We'll spill over the leftover cappuccino in the upcoming episode. Till then, for all the updates and latest episodes of my podcast, do visit www.ispharmacologydifficult.com, where you can also find and sign up for a free monthly e-newsletter of mine. It actually contains a lot of updates about the medical sciences, drug information updates, and my podcast updates also. You can follow me on different social media handles like Twitter, Insta, Facebook, and LinkedIn. They all are with the same name, is Pharmacology Difficult. If you are listening for the first time, do follow and subscribe whatever platform you are consuming this episode. Stay tuned. Do rate and review on iTunes, Apple Podcast. Stay safe, stay happy, stay enlightened. Thank you.